Hello, my name is Dr. Piyanat Priyanon, an interventional cardiologist from Perfect Heart Institute here from Bangkok, Thailand. I have Dr. Ivan Rokos with me. Welcome to Bangkok, Dr. Rokos. Dr. Mehta informed that you are the world preeminent expert in pre-hospital STEMI alert. Can some of your work be applied in Bangkok?
Absolutely, and it's a pleasure to be here. I'm an emergency physician, so I obviously don't do interventional procedures, and that to some degree is a blessing because I'm focused not on the STEMI procedure inside the cath lab, but the STEMI process outside the cath lab, and how we can quickly identify patients with STEMI and get them quickly to the front door of the cath lab. Sometimes that's very easy, sometimes that's very challenging. It can span 100 kilometers, but the same fundamental principles are needed to quickly sort through a group of chest pain patients and figure out who's having a STEMI and who can wait for further evaluation.
And there is so much talk about emergency department bypass. Is that overkill to improving the door-to-balloon times?
So emergency department bypass is something that's come up in the United States literature and also in Europe. And the key to that is if you have a good ambulance system or EMS system, as we call it, emergency medical services systems, and if they can accurately diagnose a STEMI, then you are actually, it's reasonable to bypass the emergency department as long as the cath lab is in-house. So it isn't a good strategy for 12 o'clock noon during the day. I don't think it's a good strategy or very safe at night when the cardiac cath lab team is simply not available. So it's an opportunity to improve things during the daytime. However, one of the key issues with all of this is false or inappropriate cath lab activations. And we really want to make sure that the patient does in fact have a STEMI, that they're actually appropriate to be in the cath lab, that they're, let's say, not a 90-year-old with multiple comorbidities who doesn't get out of bed for the last 5 years and can barely and has dementia. That person doesn't belong in the cath lab. So we need to make sure that we send appropriate patients to the cath lab. So yes, it's a great opportunity to accelerate care. But like with anything, you need to have filters and some checks and balances to make sure the right patients get to the front door of the cath lab.
And what other areas that Lumen Global should focus on?
So I think Lumen Global is an exciting meeting, and it's actually fun to look at the audience. There's a lot of young people there. I think that the world is changing very quickly, and a lot of that change is about the digital revolution. And I think that there's a lot we can do to create these STEMI networks literally from your desktop. It's about virtual connections via email, via texting, via other social media to connect various points of entries to your STEMI center. In the ideal world, of course, we would provide primary PCI for everybody with a ST elevation myocardial infarction, but of course the ideal is not always possible. But I think at least certain versions of that ideal are something that can be achievable, whether it's giving lytics or fibrolytics as quickly as possible, perhaps transferring the high-risk patients that fail the lytics. There are various tiered approaches that you can gradually do as your system develops and becomes more mature so that you can provide rapid reperfusion. But importantly is all these systems are based on connections, people to people being connected. And so being able to connect yourself digitally with somebody in a village 100 kilometers from here, I think is critically important. And even though you may have never met in person, being able to set up the system together digitally and then give each other feedback digitally, saying how things go, how can we improve things, I think is a wonderful opportunity and simplifies things and allows you to really comprehensively cover the city, the country, and entire continents. I think that's very exciting that the digital revolution is going to allow us to do that.
Well, thank you so much, Dr. Rokos, for joining us today.
Thank you.